name's Karen Kennedy and I'm Deputy Director within the National Diabetes Programme at NHS England. The Diabetes Programme has a leadership role, supporting systems across the NHS to reduce the incidence of type 2 diabetes within their population and improve treatment and care for all types of diabetes. We do this through developing clinically led, evidence-based policy for implementation across the NHS, securing national investment for diabetes transformation, ensuring diabetes data is collected and shared with local systems, and sharing good practice through our clinical networks and regional teams. Thank you so much for inviting me to present today at the Humber and North Yorkshire Diabetes event for primary care. It's a great opportunity for me to tell you about some of our key focus areas in primary care. I'd like to talk to you about the Healthier You Diabetes Prevention Programme, the NHS Type 2 Diabetes Path to Remission Programme, Structured Education Programme Healthy Living, and Care Process Delivery. I also want to reflect on opportunities for Humber and North Yorkshire ICB and give some top tips to you as local clinicians and leaders. Firstly, I'd like to talk to you about the Healthier You Diabetes Prevention Programme. As you may know, the Diabetes Prevention Programme is a 9-month lifestyle behaviour change programme. It's nationally commissioned and requires a GP referral for an eligible blood reading. The programme is now operating at scale around the country. We've had over 1.2 million referrals so far, and thank you for all of the work that you've done towards that. There's recently been an NIHR independent evaluation into the effectiveness of the programme that's had really significant results. For people that join the programme and complete it, we know now that they can expect to reduce their risk of developing type 2 diabetes by 37% at individual level. We can reduce population incidence of diabetes by 7%, which is very significant and will really make a difference to population health within your area. And more recently, you may have seen in the media that anyone referred to the programme reduces their risk of type 2 diabetes by 20%. The pandemic created challenges for our original target of 200,000 people per year accessing the Diabetes Prevention Programme. But the good news is that general practice has bounced back very quickly and has done a marvellous job of getting referrals back to previous levels. The other good news is we have another 2 years of national funding and really value your support in increasing referrals. General practice is really good at identifying people at high risk of type 2 diabetes. We're getting more people on the programme from higher risk categories, for example, people from deprived communities and those of Black and South Asian ethnicity. We can see that there's been a significant improvement in Humber and North Yorkshire ICB from January 22 versus the previous year. This means you're reaching more of your population and reducing their risk of type 2 diabetes, so please keep up the good work. Humber and North Yorkshire ICB will soon receive its revised figures for the number of referrals your system should be aiming for in 23-24. There's information in the accompanying slides about how you can access data on your practice, PCN, locality or ICB. Next, I'd like to talk to you about the Type 2 Diabetes Path to Remission programme. This programme provides a low-calorie diet treatment for people who are overweight and living with type 2 diabetes. The programme is based on 2 large studies that showed that it can improve diabetes control, reduce diabetes-related medication, and in some cases put type 2 diabetes into remission. The programme used to be called Low Calorie Diets, but we've recently changed the name following feedback from participants. We've secured national funding for 2 years, which means services will be available across the country by April 2024. An early evaluation on outcomes of people on the programme suggests that weight loss is on a par with the randomised control trials, which demonstrated reduced medication, good weight loss, and about half of the participants going into remission from type 2 diabetes. Congratulations to Humber and North Yorkshire for your very successful piloting of this service. Please keep the referrals coming in. Ensuring the referrals meet the eligibility criteria is key, of course. Your current path to remission provider is Aviva, and they offer a digital solution. We know that people like to take this intervention in different ways. The new framework, available from June, will allow a choice of channel, plus it builds on lessons learned from the first wave. Healthy Living for People with Type 2 Diabetes is a web-based structured education programme that provides information about Type 2 diabetes and its management, alongside support with adopting and maintaining healthy behaviours and psychological well-being. The Healthy Living programme is Kismet accredited, has randomised control trial evidence for improving HbA1c, is fully funded by NHS England and free of charge to participants, and is suitable for people with type 2 diabetes at any point after diagnosis. Healthy Living is a choice option, and it's not designed to be a replacement for face-to-face structured education commissioned locally. It's available for all people with type 2 diabetes in England and can be accessed through self-referral or direct referral from GP practices. You may not have heard about Healthy Living, so we're delighted to share more information with you today and hope to see more referrals coming through from Humber and North Yorkshire. Details about how you can refer are included in the slide pack. Finally, I'd like to talk about the diabetes care processes. The COVID-19 pandemic meant that fewer people with diabetes receive their annual care processes, and we know that fewer people were diagnosed with type 2 diabetes during the pandemic as well, particularly in the older age groups. Evidence shows that receipt of the care processes results in reduced mortality, reduced emergency admissions, reduced amputations and reduced diabetic retinopathy. The diabetes programme is therefore focused on supporting systems to recover the number of people who receive all the 8 diabetes care processes. We can see that that is recovering now to pre-pandemic levels, which is fantastic, but a key national ambition is to continue to improve this further such that we surpass the pre-pandemic levels. We know that many GP practices around the country are proactively reviewing their practice lists with a particular focus on seeing people that have not had their diabetes care processes for the longest period or who may be at higher risk of complications. We know that many practices are using their practice IT system tools to support prioritisation and risk stratification, and this will really help us meet our aims. The diabetes programme has made data on this more readily available through our Diabetes Data Hub. The National Diabetes Audit also now has interactive dashboards. Further details on how you can access these tools is available in the slides. So in summary, the key priorities for the National Diabetes Programme in primary care are to increase the number of referrals to the NHS Diabetes Prevention Programme, increase the number of referrals to the Type 2 Diabetes Path to Remission Programme, increase the amount of signposting to the Healthy Living for Type 2 Diabetes Programme, as well as increase referrals to local structured education programmes. And finally, to ensure that more people receive all 8 diabetes care processes. To support this, in 23-24, all systems will receive funding for diabetes clinical leadership. They'll also receive funding to support the implementation of the Type 2 Diabetes Path to Remission programme. We will continue to improve how we publish data to support local improvement and continue to fund diabetes clinical network support. I know you'll be hearing more about these and other initiatives in today's session. Many thanks for your continued support, and please reach out to us using the contact details in the slide pack for any further information.